I'm John Hagan, co-host of Shift by Alberta Innovates, our podcast with a focus on Alberta researchers, innovators, and innovation. In the fall of 2020, Alberta Innovates announced $2.1 million to go towards research and innovation projects, looking to slow the spread and lessen the impact of COVID-19. Today, I'm speaking with Dr. Andrei Drabovich, Assistant Professor in the Department of Laboratory Medicine and Pathology in the Faculty of Medicine and Dentistry at the University of Alberta. His was one of 7 to receive Alberta Innovates funding. Welcome, Dr. Drabovich. How are you today?
Good morning, and thank you for having me, and I'm doing well.
So, Andrei, tell us a little bit about the genesis of this work. Where did it come from? Where did the idea come from?
And we came up with this idea back in March last year when we were thinking what we can do with our knowledge, our approaches, our technologies. And we're thinking, what can we use this mass spectrometry as a tool to help to combat COVID? And we were working before in prostate cancer, for example. So we're just applying mass spectrometry to find novel prostate cancer biomarkers. And then we thought, maybe we can also apply it to infectious diseases such as COVID and measure antibodies. And I think we can clearly see the way now to apply it broadly to other infectious diseases.
Now, as that idea comes out, and you mentioned biomarkers, so antibodies are a biomarker, correct?
That's
so
correct.
Were you, I'm always curious about that eureka moment. Was it you yourself sitting there having morning coffee going, what if? Or are you sitting with a group of your colleagues and then people are, riffing on ideas? How did that come about?
I think it started when I started looking how the traditional tests are set up to measure these proteins in blood. And I realized that traditional tests have so many steps and some of them may not be efficient. The more steps you have, the less efficient you become. And we can have fewer steps in our approach, and we can do more direct measurements. And the more direct measurement, the less it's prone to error.
Excellent. So, Andrei, when do you expect to have results?
So in terms of results, we already have some results on the proof of concept. First of all, we know that this type of technology, mass spectrometry, can be used. It is working. That's what we've seen already.
Okay.
So as a proof of concept that there is a potential in this technology, like we have this result, there is a potential. And
okay.
And it has been, we proved that. And also we already starting to figure out that some subtypes of antibodies and some antigens which are used to develop in this test are indeed way better. They don't give that high, say, what's called background or false positive rate. So this is something that we probably will be able to suggest this year. So just don't do the all combinations antibodies together, but focus on this one specific subtype, which may be much more informative and also less prone to error.
That's your test should be less prone to error. And okay. So what's next? What happens now? You've got a proof of concept. You're moving forward. What's the next milestone, so to speak?
So next milestones will be clinical samples. So start to look in the cohorts of blood samples from patients who had COVID or symptomatic cases or never had COVID. So the beauty of this technology is that we can quickly adapt it to every new mutation and basically in a matter of weeks if this technology is developed.
Okay. So now that partially answers my next question, but perhaps you can flesh it out a bit more. How will this work help people?
So these type of tests, if they're not correct, they can lead to these false perceptions that maybe we already have this disease, maybe we already protected, and we don't need to do anything else. So it helps with this rational approach, how to deal with these type of diseases and infections, and it gives more, again, confidence to the public. If tests are indeed correct,
Right.
it's more confidence how to manage it properly.
Now, Andrei, would you describe a bit to us how Alberta Innovates helped you with your research and in supporting you?
So Alberta Innovates matched our CHR grant for the second year, and it gave us basically much more confidence that this approach is worth developing. And we will study additional aims, so which were not that proposed initially for CHR grant. So with
Okay.
Alberta Innovates funding, we'll go further in this project.
Okay.
We will look, for example, at the dynamics, how these antibodies may be, different antibody subtypes are disappearing in time, which can hardly, again, be done with traditional tests because there are so many combinations to try. And our approach is, in a way, multiplex, so we can look at these combinations at the same time. So versus traditional tests would take so much time and so many combinations to test. To look at the dynamics, how these antibodies are changing in time. And again, so this funding provided us also with some materials and supplies for mass spectrometry, which is quite an advanced and expensive technique to run it.
Mm-hmm. Andrei, thank you very much for speaking to us today about your project. This is fascinating work, and we're eager and excited to learn more about it as it moves into the future.
Thank you for having me today.